So, OSCE, objective, structured, clinical examination. So before anything, my name is Fazi Amir and I'm a third year medical student from IU University, and recently I just passed my third year OSCE examination, and there are a few tips that hopefully will help you guys, and after this video, hopefully you guys will get an idea of how to tackle this OSCE examination. So let's just go straight in. So first, have a timetable. Not only for OSCE but for all type of examinations, have a timetable. And is there a designated time for how many weeks you need to prepare for an OSCE? Honestly, in my opinion, no. You can have 2 months, you can have 1 month, 3 weeks, all up to you. You know your own capability. For me, how I say, okay, if you want to study in a relaxed manner without sleepless night, give it 2 months. If you want a fast pace but still relax, 1 month. If you want to cram everything in, the least is 3 weeks. 2 weeks, you're really testing your limits, my guy. For my university, if you're in your first year, okay, 2 weeks actually is enough because there's not much to cover. It's just CVS and RESP, and that's it. So 2 weeks is enough. But then when you go to third year, there's like 5 or 6 topics. So there's more to cover. So you need more time. So before anything, look at how many topics you need to cover and then match it with how many time you need left. So maybe you can put it like 1 big topic 1 week or 1 big topic specific amount of days. That's how I do it. So for me, I had 5 big topics if I'm not mistaken. Then it took me 5 weeks. So 1 week, 1 topic, 1 week, 1 topic, and that's how I tackle it. So then after mix and matching and setting how many days are there for you to study, only then you start doing your stuff. Before like studying or anything, just make a timetable so you won't miss out anything and just make everything organized. So by the time OSCE happens, there's nothing that you left out and don't need to panic. Like suddenly like everyone's talking about this but you realize you never study about it. But it's okay. You had a timetable and you look at every topic, you have covered everything. Moving on is go for the big topics first. What I mean by that is, let's say respiratory. Don't go straight in asthma, don't go straight in COPD. Go for the whole general respiratory examination first. Because only when you understand the general picture, only then you will understand the small topics of it. So don't skip your steps. Go according to the sequence. And number 3 is practice with realistic scenarios. Search online for scenarios that have a positive outcome, meaning that don't practice with just like a general examination with a patient with no disabilities or anything. Just ask your friend to come up with any disease, like say you're treating a gastrointestinal patient, and just ask your friend to fake a kidney pain or something so that you know how to report this stuff. Because if you're used to practicing only the normal, when you get to the OSCE, there's always going to be positive findings. And if you're not used to it, you won't get used to how to report this stuff. And especially for my OSCE, we have to do it under 7 minutes each station. And then when you realize that the time is coming up and all, and you don't have enough time, so you're just going to panic and the words won't come out. You just speak gibberish. Like suddenly your mouth won't be able to speak for some reason. But however, if you already practiced beforehand, if you're already used to seeing all these positive results, you can do it in a calm manner. And other than that, realistic is by timing yourself in 7 minutes. This is the crucial part. So especially history taking, time yourself 7 minutes. Because for me, first year my history taking was, let's not talk about that. That's how I would say it. But during my third year, my history taking like went all because I practiced with time. And I would practice it with, you can practice it with anyone to be honest, but just practice it under 7 minutes. Because for me, how we do it is using Socrates and this fluent on. Okay, let's say we know this patient came with a dislocated shoulder. So why do you have to ask the periods? Why do you have to ask the link about everything? And you think it's not important, but however, because it's a marking system, so you need to be smart. So even though you think it's not important, but you still need to touch on it, but you know how to touch on it. You don't have to go deep. If you think it's not relevant, touch on it, but don't really go deep. So that's how you save your 7 minutes. But the important thing is time yourself and you will get used to it. And add the buzzer to it so you get used to the buzzer noise and it won't give you a traumatic response, because that really helped me. Okay, also especially for history taking, and inside the 7 minutes, try to figure out 3 differential diagnoses, because for my university that's how they do it. So I'm not sure about yours, But inside those 7 minutes, just get a differential diagnosis. Not like define a diagnosis, just get a 3 differential diagnoses that you can figure out of what history you're taking. So whenever you take history, make sure you're asking important questions that can bring you to a diagnosis. I know that you're trying to follow a flow, but try to match it. That's why you need to practice real scenarios and also you get used to it. Okay? Number 4 is use the university facilities early. For my university, thankfully, we had what we call a self-directed learning center where they give us mannequins and you can use their torch, we can use their needles for vein puncher and all sorts of stuff. So thankfully, I had that in my university. However, use those stuff the earliest. Okay, let's say you have 1 month. Don't put everything in the last week, because everyone will do that. And then you have to book for these facilities, right? Because your batch has like 200 students and the facility won't be able to hold all those 200 students. So you need to book early. And everyone in the last week will start panicking and will go to use the facilities there. However, outsmart them, prevent the jam by going early. And when you're early, no one is there, you can use all the facilities. So master it, because when there's mannequins, there's not much difference they can do to it. Because like, let's say there's a patient and it's a respiratory examination, they can put all type of stuff. And like for my university, they even like put wounds on them, they draw and all. I like legit, I respect them for 100% salute. However, with mannequins, there's not much. Like, let's say we're doing a breast cancer examination. As long as you know how to palpate and how to comment and stuff, if the mannequin is there, it should be straightforward. So master the techniques and get your full marks there, because that's where you're gonna get most of your marks. As long as you follow the procedure, as long as you get the right technique, hopefully you can get many marks there. And it's a high percentage of getting more marks there than getting from a real patient. And number 5 is get yourself a good study group. Okay, maybe in theory, you can study alone. However, OSCE, I would say it's practically impossible for you to study alone. I mean, there are people studying alone. I see them testing on teddy bears and stuff. But university, there's a lot of people around. There's like 200 people in your batch. Let's say even like there's only 50. But there's so many people out there yourself, so make use of them. Especially for physical examination. Let's say you want to find the apex speed and everything. There's so many people, and like some people have different locations, and also test on this friend, test on this friend, and get used to all the different locations, because not everyone is on the same place. So that during your OSCE examination, you won't be shocked, like suddenly, why is this patient suddenly located there, apex speed here, and also make use of your friend there, and you test on them and then they test on you. So it's a win-win situation. Thankfully for me, I had a big study group. We came up with a plan and we had our own mock OSCE. So what we did in our friend's house, we had like 4 rooms, we had 12 people. So with 12 people, we were able to do 4 stations. Each station, we have an examiner, a patient, and then you, the student. Would make up scenarios and all. Make it like a real OSCE situation. We laugh around and all, but when we do the mock OSCE, we get serious and we get into exam mode. Number 6 is to strengthen your theory knowledge. And this is critical because like when people think about OSCE, all they think about is all the clinical examinations and then they put their theory outside. However, you forget the examiners can ask you questions also. Like they can ask you, why did you do this? Okay, why did you not do this and all? And even like this, some station where the question they ask is part of the station. But you don't have to like study like you want, like get into details of each. Just study clinical wise. Let's say you're checking the temperature. Oh, why are you checking the temperature? Make sure you know why are you doing. And whatever you're doing, just make sure you can justify that using your theory knowledge. And other clinical also look on how to read an X-ray, how to explain this type of medication, especially the famous medications like metformin and all. And last but not least, breathe in and breathe out. Stay calm, don't panic. If you already studied everything in the beginning, there's no need for you to stress out. You already covered everything, so why are you panicking? So it's okay not to master everything because it's a learning process, all right? And whenever OSCE starts, just put your mindset that you are a doctor. And let's say you can't just fake it till you make it. You're the doctor now and that is your patient. So act like you're a doctor. That's how I did it. And a bonus tip here is to practice your communication skills. Like no matter how intelligent you are, how you master every topic in the book, if you do not know how to communicate, then that is a no-no. Because as a doctor, you'll be communicating with the patient on a daily basis. So if you do not know how to communicate with a person, learn how to do it, especially for your history taking. And also practice your empathy. Make sure it is real. Even though you know it's not a real scenario and the patient is just reading from a book, just make it like it's true. Let's say the patient said, oh, my mother passed away. Don't go straight in, oh, I'm sorry. How did she pass away? Don't do that. Look at my facial expression, like you can like legit see that it is so robotic and you're just following a guideline. Put some real empathy. That's why I say act like you're a real doctor and act like it's a real patient. The patient said the mother passed away. Okay, then said, oh, I'm so sorry to hear that. Are you okay if we talk about this? Just say something to make her calm down or something. Let's say she's coughing, offer her some water. If you see her shivering, offer her if she needs a blanket. Just make sure the patient is comfortable. Okay, this is my tip. If you like stuck, because there will always be a time that is just like blank out, don't know what questions you might want to ask, just are you comfortable so far? Do you have any questions so far? Just like to fill the gap. And you don't have to talk all the time, but don't have a long gap, because that shows too much that you forgot what you're supposed to ask. And also use your seniors. Your seniors out there, they have gone through it. They know what you're going through and they are willing to teach you. Wow, that was a long video, right? I'm sorry for yapping a lot. I mean, I know that OSCE can be very hard, especially like for people who are doing it the first time. Like you used to just like writing down all your knowledge and just like spitting out, but this time you're really like facing a real patient. But just be calm, alright? Know that you can do this. You already practiced it from the beginning, so there's no need for you to panic and all. Just go straight in and be confident in yourself. Just show confidence even if you don't have it. Even though your belief in yourself is like down low here, but just show confidence and don't show it in your face. You watching this video is already a big achievement and it's already a big step in you achieving success in this OSCE examination. So now is just for you to start whatever you were planning to do and just go ace this OSCE examination. I'm gonna stop yapping here so you can go continue and do your study. But all the best in your examination. I wish you good luck and hopefully we all become doctors. So like, subscribe and comment down below whatever you want to see next, and I'll see you in the next video. This was Fazzy Tanker and bye bye. See you.